youth sports injuries is becoming an epidemic. Kids nowadays are playing sports at a much higher frequency, a much higher rate. They're playing year round, and so we're seeing a lot more injuries in adolescents and kids. When you look at youth sports injuries, the things we break them down, how we break them down is either chronic overuse injuries, and that's from doing too much of the same sport, or it's acute injuries. When we talk about acute injuries, the most common things we see ACL tears in the knee, we see concussions with traumatic head injuries, we see growth plate injuries in our kids who have open growth plates. Those are sort of the main, and then we see dislocations, like a dislocation of the shoulder. Those are the main acute injuries that we see. The chronic overuse injuries are usually due to repetitive stress onto a joint or a growth plate. So when you talk about around the knee, we see chronic patellar tendonitis, we see growth plate type inflammation, anterior knee pain. In the shoulder, we see little leaguer's shoulder, which is inflammation of the growth plate in the shoulder due to too much throwing. Similar in the elbow, we see little leaguer's elbow, which is a growth plate inflammation in the elbow. Seaver's disease in the heel and the calcaneus bone is the growth plate that gets inflamed. So those chronic overuse injuries get inflammation in the bones or the joints, and those are definitely avoidable by modifying their activities. But those are the main types of injuries that we see. The frequency of injuries that we see are different based on the ages, and that's due to how open the growth plates are. So we'll see when the growth plates are wide open, and say males that are 8, 9, 10 years old, that's when we'll see common little leaguer shoulder, little leaguer elbow, when those growth plates are wide open and they're doing too much throwing. Seaver's disease happens in that same age group when kids are running a lot and they get inflammation in the heel bone there in your calcaneus. And so, yes, as you get older, those growth plates become smaller and more stable, and so because of that, you see less injuries as people age. When you're talking about acute injuries, you look at ACL injuries, for example, very common in the female population because multifactorial. There are multiple reasons for that. It's the way females are built. Their hamstring and quadriceps muscle balance is a little bit different. The way females land, they land more knock-kneed or in what we call valgus malalignment. And also their feet tend to be a little bit more looser ligaments, so they're pronated, and when they pronate, they tend to land more with a knock-kneed or valgus alignment. When that happens, those are all risk factors for tearing your ACL. Females, a spike in injuries occurs in that age group where females' hormones are changing for all of those reasons. Hormonally, they become a little bit looser ligaments. Ligaments tend to be more lax. It's related to childbearing, and their feet tend to be more flatter. All of it is hormonal, and for that reason, people have higher risks of tearing. So you look at the 13, 14, 15, 16-year-old female range, that's where we see the big spike of ACL injuries. So certainly, those are just two examples of how age and body development can affect the injuries that you get. The great thing about a lot of these overuse adolescent injuries is they don't require surgery. And that's comforting for a lot of parents to hear, but it also makes them stay out. So a lot of these overuse injuries in adolescence, these growth plate type injuries and muscle and tendon strains, things like that, you treat them by doing the obvious. You treat them by RICE, rest, ice, compression, elevation, and then you also treat them by shutting them down from their sport. And that's the hardest thing to explain to a 10-year-old kid, that you can't go play baseball with your buddies for the next 6 weeks or 8 weeks, because it's hard to hold kids back. But that is really the reality of a lot of these injuries. They're overuse, and you have to have a doctor tell them, hey, you got to slow down, you got to shut this down, because a lot of times parents are living through their kids and they don't want their kids to stop. They think their kids are the next Major League Baseball players and Olympians, and that's great to think that way, but you also have to look out for your kids' health.